That's an ambulance, somebody was receiving him.
We're not going to get any ET code on it. It's not an ET either, and it's not in your printer poster. What's the address for the emergency? Sanford Ambulance and Ready Bill, this is Casey.
Hi, I need an ambulance.
Okay, what's the address of where you need the ambulance?
4200 19th Avenue South in Fargo.
Okay, 4200 19th Avenue South in Fargo. And what is your name?
Jessica.
And Jessica, what's the phone number in case we get disconnected?
701-234-1986.
701-234-1986. Tell me exactly what happened.
My dad's having chest pain.
Okay, and are you with him now?
Yeah.
Okay, and how old is he?
88.
Okay, is he awake?
Yeah, he's conscious.
Okay, is he breathing?
Yeah.
Okay, I'm going to have a couple more questions for you. Is he completely alert?
Yeah.
Is he breathing normally?
Yeah.
Okay, is he changing color?
Yeah, he's pretty pale and kind of gray.
Pale and gray. Okay, is he clammy or having cold sweats?
Yeah, he's clammy.
All right, has he ever had a heart attack or angina?
Yeah, he has.
Okay, which has he had?
He's had a heart attack.
A heart attack? Okay. Did he take any drugs or medication in the past 12 hours?
I think he took some aspirin and maybe a nitro.
All right, I'm just going to put that in here. All right, I'm sending the paramedics to help you now. Stay on the line and I'll tell you exactly what to do next.
Okay.
If there's a defibrillator available, send someone to get it now in case we need it later. Remind him to do what his doctor has instructed for these situations. Reassure him that help is on the way. From now on, don't let him have anything to eat or drink. It might make him sick or cause further problems. Just let him rest in the most comfortable position and wait for help to arrive. I want you to watch him very closely. If he becomes less awake and vomit, quickly turn him on his side. And before the responders arrive, please put away any pets, gather his medications, and unlock the door. If he gets worse in any way, call us back immediately for further instructions.
Okay.
Okay, they're on the way for you, Jess.
Okay, thank you.
Thank you.
Bye.
Bye. Central dispatch to 805 and 600. Respond to a medical at 4200 19th Avenue South in Fargo. It's going to be for an 88-year-old male who's having chest pain. He is awake and breathing. He's pale and clammy. He does have a history of heart attacks. He has taken some aspirin and some nitro. The code's going to be a 10 David 3. Again, it's at 4200 19th Avenue South in Fargo.
To the left.
Hello, my name's Josh. What's your name?
Bob.
Bob. What's going on today, Bob?
I don't know.
You don't know? You have pain anywhere, Bob?
Yeah, I had pain yesterday.
Okay, where was that pain at?
Right about here.
Okay, do you have pain now?
Yeah, I've got a pacemaker there.
You got a pacemaker there, okay. I'm gonna take your vitals here. What's your birthday, Bob?
Pardon?
What day is your birthday? Okay,
A long time ago.
Sats at 94%, heart rate 66. Is that okay if I do a blood pressure over here?
Sure, yeah.
All right.
Whatever you gotta do.
Are you on any medication?
What's that?
Are you on any medication?
All kinds of them.
All kinds of them?
6 or 8, 10 of them, I don't know.
Okay. Anything for your heart?
Yeah,
Yeah. Do you have nitro?
I got a bottle in my pocket.
You got a bottle? Have you taken any nitro?
I did a while, a couple months ago I did.
Oh, a couple months ago, but none today or yesterday? Who's the president?
Hey guys.
Biden.
About 4 quarters in my pocket, and how much does that make?
$1.
Josh, what's the update over here?
Okay. Hi there.
This is Bob.
Hi there.
Vital signs are all good. That's 96%. Room air.
Okay.
Heart rate is 67. Blood pressure is
One medication.
70.
Okay.
Bob said he initially said he was having some chest pain. Now he's not having chest pain.
Okay.
Chest pain yesterday. Currently not complaining of any other complaints.
Okay. When did this chest pain all start? Did you have some today?
No, haven't had it for quite a while.
No.
No.
Okay. Well, I tell you what. How about we help you over to our bed and we'll hook you up and take a peek at the.
Okay, I don't need that very often.
Here, helmet. Okay, help you. There we go.
Your ankle right here.
Couple steps.
Right here.
Right here.
Perfect.
All right, we'll turn and swing your feet up here.
There you go.
There we go.
Feel like you're bending in the right spots, Bob?
Yeah.
Yeah? You want to scoot up a little bit?
We'll give you a little bit of a boost here. Ready? 1, 2, 3. There we go. All right. I'm gonna do a monitor now. Yeah. All right. I'm gonna get this on you. Just like that.
Well, I'm gonna put a few stickers on you.
Well, there. Sticker.
Yep.
I had this about a month ago and I put stickers on my wife. Oh, right, she had it for 2 days, she couldn't find them all.
Just gonna unbutton your shirt here. There we go.
And borrow a finger for a second. There we go.
If you can walk under that.
Got 2 more. I'm gonna stick them right on your stomach here.
Oh,
Sorry. Another one on this side. There we go.
And a bunch more for you.
Put more in
I'm
there.
gonna put these on your chest, okay?
How old are you?
83,
Okay.
back in February, 24th.
Just a few more. You're gonna be finding these for days.
Yeah, oh. Last time I was in the hospital, they put so many stickers on me, I found them 2 days later.
Just 2 more. Last one.
Getting colder all the time.
There we go.
All right, hold still for just a couple seconds here. Okay. And looks positive for ST elevation. All right. And you normally go to Sanford, you said?
Yeah,
Okay.
normally I have been.
Okay.
Okay, we'll head there.
Going up. Try to keep your arms inside the ride, all right?
Then I'll have to go to the doctor.
Few bumps in, Bob.
I think we'll be all right. Thank you, guys. Your stuff. That.
Anything for me, boss?
No, I think we'll be all right.
Yeah? You head on the road to Sanford?
Yeah, just gotta call them real quick and get call a STEMI alert.
Okay. Let me know when you're ready to go.
Sure. Hey Brooke, this is Dwayne with FM Ambulance. We are doing that mock STEMI patient, so I am calling you to alert you, and we will be transporting in about 30 seconds. We're coming from just across the interstate on 42nd Street, 83-year-old male having intermittent chest pain. Right now, last blood pressure was in the 140 systolic, SATI 96% on room air, heart rate is 72 and regular. And we'll be getting an IV on the way, and we should be at your facility in about 4 to 5 minutes. All right, thank you. Sure. Alright. So I'm just gonna put a, just tape a little fake IV on you. There we go. Alright.
Heavy transferring.
6752 to South Door.
Stanford, go ahead.
Sanford 6752, interrupt your facility with the 83-year-old male patient I called about a STEMI alert. Resting comfortably at this time. Initial complaints of some intermittent chest pain was positive for some ST elevation. Heart rate 72, steady 94% on room air. Last blood pressure is in the 130 systolic. We'll see in about 3 to 5.
Stanford copy, Steamer change, no.
Alright, here we go. About 4 blocks away from the hospital. So when we get there, we're going to take you over to the ER. And the ER is going to ask you a bunch of questions. And then we'll probably go take you back up to the elevator where they take you to the Cath Lab. And then they're going to do their little thing. So.
We're gonna take you up to Cath Lab, okay?
Okay. pretty close to home.
That's good.
All right, just about done. Almost.
Almost halfway.
You can go feet first.
We're with the mock one, right?
Yeah.
Okay. Oh, geez.
Hi, Chevy.
Hey,
Hey, Bob.
on here too.
All right.
Hi, we're gonna move really fast here. Oh, you're gonna go feet first.
Feet for sensor.
Bob, how are you doing? How are you feeling? Yeah, have any chest pain at all?
Pardon?
Any chest pain at all? Excited to start it.
You're okay?
Kind of intermittent yesterday and today, he said.
Okay.
Thank you.
No, we're not. The stickers want to stay with us. Needle pulses are 33.
Are you having any shortness of breath at all?
All right, we'll get them.
All right. Couple bumps here.
Move it over here. You can drop down a little bit. Leave your head down a little more.
All right. You're gonna lean back just a little bit.
Oh, there we go.
All right. You can grab it
Turn
there.
over a little bit more. Perfect. We're gonna each pull over a bed here, okay? 1, 2, 3. There we go. Right here. So we're gonna get some clothes off these two. We're gonna get you moved up here. You know, attach the on you, okay? Alright. Just move it up a little bit here. Alright, get this off you.
Excuse me. Sorry. Yep.
My name is Macy. I'm a RN in the Sanford Cath Lab, and I've been here for 2.5 years. The Cath Lab, we do a variety of procedures such as angiograms is the most common one. It's when we go to explore the arteries in your heart to make sure that there's no blockages. If there are blockages, we either use balloon assist or stenting to open up the blockage to decrease any symptoms the patient may have. We do a variety of electrophysiology procedures such as pacemakers, ablations, valve replacements called TAVIs, and structural heart. We'll get them set up on the table. We'll do just a diagnostic angiogram, which basically just means we're going to look at both the left and the right side of the heart and the arteries, make sure that there's no blockages. If we see a blockage, that's when we kind of develop a plan of how we're going to open up that blockage. So I would say there's about 5 people in the team, including the doctor. So we'll have the nurse kind of behind the scenes taking care of the patients, monitoring vitals, giving medications. We have the scrub tech that assists the doctor in the procedure, and then we have a rad tech that is driving the table. We also have a monitor behind the scenes that does all the monitoring, kind of watches the vital signs, documents the whole procedure. We just, I guess for me, before I came to the cath lab, I thought that we basically did angiograms, and just coming here, we do such a variety of things, such as structural heart. So we do TAVRs, which are the valve replacements. We do Watchmen and mitral clips. We do a variety of neuro cases and EP studies. So just do kind of a variety of things.
Spin you around here. So, this is Robert, goes by Bob.
Hi, Bob. Hey, Bob.
83-year-old gentleman having intermittent chest pain since yesterday. Got a little bit worse today.
I cooked up.
and 12 lead look positive for some ST elevation.
Okay.
Otherwise, pressure's been 130 systolic. Is diabetic, but his blood sugar was good, 116, I believe. And let's see, put this over here. All right. Do you want to scooch on over there?
Yeah.
I forgot a sheet.
See that? Switch. Get it on the other. There we go. Very good.
All right.
Look at that.
Hold on one second. Okay. There we go. Now I got the sheet on again. Okay, so you keep your arms right there. We'll move you. Wait, 1, 2, 3. There we go.
Hello, so tell me what's going on today, Bob. We're going to be doing a bunch of things at the same time here.
Okay.
Yeah.
We need to get at your chest. We need to put some leads on here. Tell me what happened today.
Nothing happened.
When did this pain start coming on?
About a week ago. No. This morning.
Okay, what were you doing?
I wasn't doing anything. I was just laying around.
And it just kind of started all of a sudden?
Yeah.
What does it feel like? Is it a sharp pain? Is it a pressure?
No, just a little dull pain.
Okay.
Does the blood pressure come over here?
Does it get worse if you take a deep breath?
Yeah.
Or does it not change at all? Oh, do you feel sick to your stomach at all?
No.
Okay, we're going to kind of come at you and do lots of things here. We need to take an electrical picture of your heart.
Oh, no.
We're going to stick an IV in you here.
You're going to hurt?
Well,
Be as nice as I can.
and we'll see what this EKG shows, and then we'll kind of go from there, okay?
Okay. It's cold.
I know, we had it all in the fridge before we came here, so just because we knew we were coming, we thought we'd get you a little chilly. So you feeling sick to your stomach at all?
No, not really.
Okay, how about, are you short of breath?
No.
Well, that's good.
It's been cool, wasn't it?
Kind of hard. I'm sure she's over that. That's Jennifer. Okay, I'm gonna have you hold real still for just a little bit here. Okay. All right. I'm gonna go show this to the doctor. And I think we're gonna be doing some things kind of fast here. We're gonna stick an IV in you, and we're gonna be giving you some medications. The doctor will come in and talk to you, and then I'm guessing he'll get a hold of cardiology, and then we'll go from there, okay?
Okay.
Looks like we're having an issue with your heart here. So we'll get those things started for you. Ashley's gonna put an IV in, all right?
I'm Sonia. I'm a nurse in the ER. I've been here for 24 years. I am the trauma educator. I teach a lot of classes. I work on the floor as well. I'm one of the charge nurses, so I play a lot of different roles in the ER. Maybe at night or on the weekends if the cath lab isn't in-house and it's coming in, we may need to hold it here, keep it or stabilized prior to going up the cath lab if they're not here. In the ER, we obviously aren't going to do the procedures. We're going to keep the patient stable, make sure we have our IVs in, get them undressed, get an EKG that's official for the ER chart, and get that kind of stuff done, make sure their lines are ready, maybe give them some medications and get them ready to, as soon as the cath lab is in-house, we can get them up there and get them on the table.
How long typically is it until the cath lab's ready for them?
10, 15 minutes probably. if they're coming, in the middle of the night, it might take a little bit longer. If they're coming from, I think if you're on call, you have to be within like 15 minutes. And so it's not going to, usually not very long time frame. And I would think that they would have a heads up prior to you guys getting here. And so they're probably already on the way in. And so as soon as they get there, then we can head upstairs.
Holy cats, that was a lot of information. Let's try and break it down and do a little debrief. So STEMI stands for ST segment elevation myocardial infarction. That pink piece of paper that came out of the monitor with all those squiggly lines on it, 2 of those lines are called your ST segment. Now, when that's elevated, that is a indicator to us that someone's having a myocardial infarction, or commonly known as a heart attack. A heart attack happens when bad things like plaque, Big Macs, and other things like that build up within the vessels within your heart and cause an occlusion. Now, there's a few things that in the ambulance that we're going to do for them, but ultimately what this person needs is the cath lab to get those blockages taken care of. In the ambulance, what we're going to do is we're going to give you chewable aspirin to slicken up the platelets, and we're also going to give you heparin to help thin your blood so it's an easier pathway to the other side of the heart. So if you think about it, those blockages are blocking the blood flow to a section of the heart, which heart muscle, unlike other muscle in your body, doesn't regenerate. So that's where you get the chest pain and obviously the heart damage from lack of blood flow. Coming up for Explorers, there's a whole bunch of things. Early September, we'll be visiting each of the area high schools throughout Cass and Clay County. At the end of September, there will be an open house night for parents to come with the high schooler to get registered, ask questions, visit the building, and prepare themselves for the next week in October when we start the program on the first Monday. If you'd like more information on Sanford Ambulance Explorers, you can visit sanfordhealthemseducation.org or contact us at the number listed at the end of the video. We wanted to thank everyone who helped make these videos a success. Without their continued support, the series would not have been possible.